Compounding medications in a rural setting, an interprofessional perspective. Interprofessional learning, or IPL, which focuses on the pharmacist's role in specialty practice as part of a multidisciplinary healthcare team, has not been explored. This study aimed to determine healthcare students' understanding of the role of the pharmacist in compounding medications to optimise health outcomes for patients in rural and remote healthcare services. 4 workshops followed by focus group interviews were conducted with 15 undergraduate pharmacy, medical, nursing, physiotherapy, dentistry, Aboriginal public health and speech pathology students. After an introductory lecture, students working in multidisciplinary teams undertook to compound 3 products. Focus groups were held at the end of the compounding workshops to explore students' understanding and perceptions of these compounding activities. Thematic analysis was undertaken on the qualitative data obtained from the focus groups. Student participants responded positively to the opportunity to undertake a compounding exercise, as well as being part of an interprofessional team, perceiving benefit for their future rural and remote health practice. 4 major themes emerged from the qualitative analysis. Improved knowledge and understanding.
Because I have had no exposure to compounding medicine, so it's really new for me. So it's just being aware of these things that's out there. In future, if I have a patient and something like this comes up, I know that there are other options available and I wish we had something like this at our med school.
Application to practice.
I think that could be integrated better and we could be made aware of the fact that this is an option, because as everyone said, especially in rural and remote areas which our degree focuses on, I think that there's a lot of misconceptions about medications. So if you can deliver it in a different way or a way that's effective for that person, that's better for them than a generalised approach.
Interprofessional collaboration.
I think it's really good for people in other disciplines to understand the different, less prominent aspects of our role in a pharmacy.
And rural, remote and Indigenous context.
With Aboriginal health, some people don't have electricity, they don't have a fridge, they don't have all these other things, so we've got to think of alternative ways to deliver that so people can be well.
Students acknowledged that the workshops improved their understanding of the role of the pharmacist in compounding and how they, as part of a multidisciplinary team, could deliver better health outcomes for patients with special needs, especially in a rural and remote context. The study highlights that workshops of this nature have a role to play in developing collaborative interprofessional practice and increasing awareness of pharmaceutical services among undergraduate health students. However, further evidence is needed to assess whether positive perceptions of specialty practice IPL workshops will translate into improved patient outcomes in practice.